Good morning. Happy Monday, August 1st. So what's going on now? It's already August. July is gone. And our Chicago White Sox are playing superbly at being mediocre. And our Cubs, well, there are Cubs, and there's always next year. And it's nice to see football is getting back underway with training camp going. Happy to see that. And maybe we'll have a good year with a new coach in Eberflus. And the Bears can give us a little bit more promise than what they've had in the previous years. Did you see that Robert Crimno, the Highland Park shooter, was indicted last week on 17 counts, of which 21 counts were considered first-degree murder? I can't see how he'll actually go to trial on that. And, the other thlightning that's going on, did you see that the CWB is reporting now that Mayor Lightfoot, her motorcade is racing up and down the streets of Chicago, and those speed cameras have gotten tickets for them that she's refusing to pay. Tickets even in school zones. I guess I should have gone into politics. Then if I went into politics, I could violate common laws of society without consequences. Hey, let's get to today's topic. So obviously, I didn't go into politics. I went into the insurance business. I opened up the MLD agency 30 years ago after having been in the insurance business for about 8 years. The reason I opened up the MLD agency is I didn't want to be working for a large insurance company because I had done that and I felt like I was a pawn with the insurance company for this district manager versus that district manager. We're going to trademark back and forth. So I feel sorry for baseball players and professional athletes who get traded back and forth. I also worked for another insurance company that was a large one, and they didn't know what to do with me after they hired me, and I kept bouncing around, so I got tired of that, and I opened up the MLD agency. There was a thought about going to work for an independent, but most of the independents, I really didn't trust them. I didn't trust that they would compensate me, that their financial interests would be ahead of mine, and they didn't have the ethics that I wanted to open up a business with. So that's the reason why I opened up the MLD agency. MLD stands for Medical, Life, and Disability. It does not stand for Mark L. Dupre. When I was actually filing the papers, it was going to be LMD because I was more comfortable selling the life insurance at the time. But my wife says, why don't you use your initials, MLD? So that's how it became MLD. And with that medical being first, most of my business then instantly gravitated into the medical-based insurance products. So a question I was asked, what have I learned over the last 30 years? And two things immediately come to my mind. One is premiums. Forget the advertisements on TV. Premiums are not the most important things. However, people buy based on premiums, but they expect coverage. They want to be with a quality insurance company that they can trust to pay their claims. And let me give you an example. A number of years ago, a guy wanted to buy an insurance policy with a very, very reputable insurance company, but it didn't have a quality network. And I told him, I don't think you want this. I think you want this one here because the hospital you want to be able to go to is not going to be in that network. Yeah, you're going to save $20, but it's not going to be in the network. Unfortunately, he had a hospital stay. And he told me afterwards, he says, you know what? If I had bought the policy I was originally looking at, I wouldn't have been able to go to the hospital. I wouldn't have been able to get the care I need, and I wouldn't have recovered the way I would have expected. And I don't care about the $20 a month that I saved because I could have blown that on anything. So premiums are the number one thing that I've learned. It's not the most important thing to save $1. It's to be with the right insurance company to have the right coverage. So the second thing I've learned in the insurance business is the claims factor here. When people have a claim, they feel like they've been victimized by something, and they want their claims paid. They want to be made as whole as possible. An insurance company is very, very black and white. If it's in the policy, it's covered. If it's not in the policy, it's not. So to educate the client properly is important, that they understand their deductibles, their co-insurance, their max out-of-pocket. Is there a co-pay for doctor's visits, for ER visits? How do their prescriptions work? These are very basic things that people want. They may not be interested in it, but when they have a claim, they want that claim paid. The other thing is, with claims being properly paid to the client's expectations, that's where the true satisfaction comes. If somebody tells me, I have the greatest insurance company in the whole world, this company is fantastic. Have you had claims? No. Well, how do you know? Did the rubber meet the road? The rubber meets the road when that insurance company pays their claims. You know, here's another thing that people ask me at times. Mark, how have you survived 30 years with the MLD agency and 38 years in this business? It's an interesting question, but it's a good question to ask. And for agents who may be listening to this who want to get into this business or starting off in this business, you survive by being ethical. Ethical means doing the right thing at all times. When you behave this way, then your clients are going to stay with you, and they're going to refer their friends and their families, their co-workers, their children and whatnot to you. And that's the lifeblood of an insurance agency. Forget the commercials on TV. The lifeblood is you doing your job to the best of your ability, ethically, with your client's best interest at heart, and they will refer and continue to refer their friends, their family, their co-workers to you. That's the lifeblood of a business. So hey Mark, what's going on at the MLD agency? Well, last week we completed our certification for the MLD agency's Medicare prescription drug plans, Medicare Advantage prescription drug plans. Before I told you, I personally had to complete it, but I also completed it for the MLD agency. So we have the exact same carriers in 2023 that we have had in 2022. The other thing is we were able to help two groups solidify their group health insurance for August 1st. That's what's going on in the MLD agency. Don't hesitate to give us a call. Bottom of the screen here is our phone number and email address so that we can work with you to make sure that you have what is in your best interest. Until next week.